I have another question, and I know I've got some time here. A couple of you today have talked about, and other experts in the field have talked about a greater federal role in this area. And I just wanted to be a little more specific about this. If the federal government is going to get involved more, say along the lines of the Canada Health Act, shall we say, then what that actually would involve, as far as I understand, would be the federal government providing money in return for greater regulation. At the moment, there is no regulation on the part of the federal government. This is a provincial area. So presumably to make the service, to improve the service, we are not actually looking for a common standard across the country. We are looking for a better standard across the country than what we are seeing now. So in return for the money, presumably there would be a much stronger regulatory framework that would cover presumably many areas of operation. So, you know, it's not just the money. Of course, everybody wants the money, but it has to come with something. So I just want to be a little specific about whether you actually welcome this particular model. And Dr. Hébert, you've been very helpful in setting out you know, a couple of different models there, but I want to ask you specifically if you do favor this model, Ms. Hall and Dr. Easterbrook as well. So is this what you would see? Is this what you actually are calling for, keeping in mind that the federal role would have to be much greater, I presume? Thank you.
Qui veut répondre en premier?
So who would like to answer first? Do you want to answer first, Dr. Hébert?
I think the federal has two options, either by having a law, having a bill passed to set up standards, principles for inviting provinces to adhere to these principles and if they adhere, there are a part of funding that is coming from the federal or allocating direct payment to people. I think the first model is the model of the Canada Health Act, and it was very effective in order to set up those standards. And you see in Quebec, for example, the two last Minister of Health has written to the Quebec in order to correct the situation for the accessory fees that was charged to people and was in contravention to the Canada Health Act, and it was very effective. So even in the hospital context, it's still very effective to have those principles. And what we've seen over the last years is that the federal is providing much more money for home care, for example, without setting standards. And you know, when I was minister, we allocated 20% more budget for home care. And when a couple of years later, when we monitor the services that the people received, the services decreased dramatically. So there was no effect of 20% increase in the budget for home care. And I'm quite sure that it's going to be the same for the $6 billion injection of the federal, because the provinces and the institutions are prioritizing hospital care and access to hospital. And so there will not be a direct effect on home care and even on nursing homes. So giving more money is not enough. You have to set standards or to give money directly to people. That's the two options the federal government has.
Merci, Dr. Hébert.
Thank you, Dr. Hébert.
Exactly.
Mm-hmm.